Welcome to Between the Sheets, the podcast where we're going to cover a variety of topics related to sexual health and wellness. I'm Dr. Stephanie Zwonitzer, your host. I'm a nurse practitioner and have been in practice since 2017. I have my Doctor of Nursing Practice degree, and I specialize in urology and sexual health. I am so excited to explore all of the various topics related to sexual health and wellness with you in a fun, spicy, educational, and non-judgmental manner. So come on, let's get between the sheets. Hey, welcome back to Between the Sheets. I have Donna White with us today. She is the hormone authority, and I am very excited to have her on today. And we're going to talk about her new book, The Hormone Makeover, as well as just how we can help other women going through perimenopause and menopause, and really kind of busting through some of these myths and lies that we've been told over the years and getting our ladies on the best treatment that they can so that they can feel their best. Welcome, Donna. Thank you so much for being here.
Thank you, Stephanie. I appreciate you having me. I'm looking forward to sharing some things with your audience that will help them. And by the way, I really like your podcast. I mean, Between the Sheets and what you're doing is so helpful to women. So I appreciate your work.
Thank you. Absolutely. I have a lot of fun with it. So it's been a fun adventure. So tell me how, I know that you've been in hormones for years and years, and you have this training academy for providers like myself to learn more. But how did the hormone makeover and, kind of getting it more to the public come about?
Well, because I'm on the same mission you're on, I think we want women to understand what happens to their hormones, what goes wrong, and then what to do about it, how we can overcome some of these frustrating issues and challenges we have as women, whether it's premenstrually or perimenopausally or as we go through menopause. Women need this information, and it's overdue. The time is come that we need to get this information out. So that is why, because women are looking for it, and as well, providers are as well. They want to learn how to help women get their hormones in balance, whether it is for our health or aging or weight or any of the symptoms, hormone balance, which we can talk about, but it's about empowering women so that, menopause is something to be celebrated, not something to be dreaded or suffer with.
Yeah, and it's so interesting because, my mom is obviously a couple generations ahead of me, and she was going through issues with menopause and life changes during the time that the Women's Health Initiative came out and said, hold the phone, stop the estrogen, you're all going to get breast cancer. And we have since learned that that is not true. And so I just watched her journey and how much she had to go through things. And luckily for her, she was not, someone who had horrible side effects, but still, I think there's so many ways she could have benefited from it. And I'm in perimenopause, so I want to benefit from it. So talk me through, what are the major hormones that we're looking at?
Well, I'm so glad that you brought up this point, Stephanie. Hormones are confusing. You just bring up the word hormones and people think, oh, hormones cause breast cancer or hormones cause heart disease. And honestly, far too many providers are still saying, oh, you can't take hormones because you'll get, that increases your risk of breast cancer. When at this point in time in history, research has shown that that is not the case. And you brought up the study that really started things heading in the wrong direction.
Yes.
It's left people like your mother struggling and suffering. So that study that came out in 2002 was the Women's Health Initiative, and it did find that the women taking those type of hormones, which was estrogen from pregnant mare's urine and synthetic progesterone, when they took those two hormones, there was an increased risk of heart disease, breast cancer. But that's the point. That was non-bioidentical hormones. That was horse estrogen and synthetic progesterone. And then when even the original researchers that did that study went back and looked at it 18, 19 years later, they said, hey, wait a minute. Estrogen doesn't cause breast cancer. In fact, it reduces the risk of breast cancer, reduces the risk of breast cancer by 23%. And what we know also is if women have taken hormone replacement and then get breast cancer, they have a 44% less risk of dying from it.
Wow.
Other studies corroborate this as well. Estrogen does not cause breast cancer. Now, there are causes of breast cancer, as we know, but estrogen isn't one of them. And if we look at it hormone by hormone, because that was your original question.
Yep.
Sorry, I took the long way around.
No, that's okay.
Because you brought up so many good points. I just couldn't.
I did my research. I read your book.
And I'm sure you know most of the things.
Yeah.
And I'm sure your audience is very savvy because they listen to you. So if we break it down by hormone, so estrogen, and we can talk about each hormone in relationship to libido if we want to.
Yes.
Anyway, so the estrogen we know doesn't cause, from studies, and anything that I share, I always have to base it on studies. I'm very, very, very particular about that. So estrogen doesn't increase the risk of breast cancer. It's actually protective. Progesterone helps reduce the risk of breast cancer, and so does testosterone for women. We need testosterone too, which
yes, we do.
You know, some studies are showing that testosterone can reduce the risk of breast cancer by as much as 40%. So what we're talking about here, when you and I are talking about hormones, we are not talking about what I refer to as non-bioidentical hormones. And there's so much confusion about that. What kind of hormone? What hormones are you talking about? I'm not talking about those. I'm not excited about using those. I'm excited about bioidentical hormones, because when it comes to hormones, we want to take the safer, healthier versions of them. Right. So if we could just clarify that, I think it's kind of important. So bioidentical hormones are human identical. They're exact replicas of the hormones our bodies should be making, used to make, that we need. So they're exactly the same. They're not synthetic. They're not animal derived. They're human identical. And this term bioidentical, it's not an official medical term, but we use that to distinguish between what kind of hormones they are. They're exactly like our hormones. So what you do is you find out, through proper testing, which hormone you might be low in, and replace what you need to the amount that you need. And that's where you get the benefits of balanced hormones. And in a quick nutshell, when women, what we know from decades of research on biologically identical hormones is that women on hormones have less heart disease, less AFib, less, cardiovascular disease. They have less breast cancer. Women on hormones live longer. They have less risk of osteoporosis. They have less risk of cognitive decline and Alzheimer's. They have better quality of life. And this is really cool too. Women on hormones look younger. Women
Love that.
I know. Why not?
Sign me up.
This way as long as I can. So women on hormones, they have better quality of life, better sexual function, better sleep. So women, hormones aren't something to be afraid of. They're something to be understood. So thank you for allowing me to talk about it, and all the other episodes where you've, had people, explain that to women. Hormones aren't scary. We're supposed to have normal levels and protected if we do have normal levels.
Yeah. I think one of the things that I've learned about the menopause and the hormone shifts that was striking to me was the correlation with Alzheimer's. I did not know that was such a correlation prior to kind of learning more about the hormones and menopause. And I mean, you had talked about it in your book too, but just the link of having appropriate amounts of estrogen in your body and how much that benefits your brain.
Oh, it does. And think about, you and I we're trying to talk to women here. How many times women go to their provider like, I think I have Alzheimer's. No, you just don't have any brain, estrogen to your brain, because every single, brain function requires estrogen. Here's some examples like verbal recall for our brain to take in information, store it, but retrieve it on demand, person's name. What's that person's name? Yeah. Or you go to the pantry, like,
Yeah.
That's what we need estrogen for. So yes, for normal function, but also yes, for preventing cognitive decline. Our brain runs off of estrogen for thinking processes.
Yeah.
And even like progesterone, that's a calming hormone to our brain so that we're not all
Yeah.
irritable and stressed out.
Right. Yeah, I think that was so interesting to learn because, when we talk about the reproductive hormones, we just think about what they do for us for making babies, having our period, those kinds of things. But we don't just think about the holistic aspect of these hormones and all of the body systems that they're involved in.
Yes, they named them wrong. They're not just for reproduction. Our brain hormones protect our brains, our bone, our vision, our gums, our skin, our joints. I mean, so much. They're not just for making babies.
Yeah. So I love in your book that you have these like 7 questions that you can kind of work through to see, are your hormones balanced, not balanced? And obviously I don't want to take away from the book because everybody can go buy that. But kind of some major highlights here for our listeners as to, hey, if you've got a couple of these things going on, you are probably imbalanced. What are your top ones?
Yes, thank you for bringing that up because there's 7 quick questions we can ask real quick. And I'm glad that you brought it up because women don't always realize that their hormones might be out of balance. Oh, I just don't, I'm not eating right, or I should be exercising or whatever. They don't connect some of these symptoms to hormone imbalance. So let's run through those. And the first one is fatigue, whether it's tired all day long or just afternoon fatigue or tired early in the evening. Like, I just can't wait to get the dinner cooked and the kids in the bed because I just want to go to sleep. That low grade fatigue can be associated with hormone imbalance, as can poor sleep, whether it's not being able to get to sleep. Like you're so tired, put your head on the pillow, and then you're thinking about what you could have done, what you should have done, what you still have to do. Your brain starts going. Or for some women, they get to sleep just fine, but they wake up at 3 o'clock, 4 o'clock, 5 o'clock. They can't get back to sleep. So that's fatigue issues, sleep issues, cognitive function, whether, how's your brain working? Can you remember people's names? Can you remember, all the things that you're trying to retain in your brain? So foggy thinking is a symptom. So is weight gain. Especially when, it's like somebody changes the margins, you're doing everything you used to do. Or, maybe in the past you could drop 2 or 3 pounds just by, eating less. Not so much if your hormones are out of balance. So it's, if you're eating right and doing all the right things, but not being able to maintain your waistline, not being able to lose like you should when you're doing things right. Rapid wrinkles is another sign of hormone decline. Mood issues, whether it's just feeling weepy, crying at commercials, just like, what's wrong with me? I just feel sad today, but everything is, pretty decent. So mood issues, whether it's, feeling weepy or whether it's irritability, anxiety, mood swings, that sort of things that we women deal with. So there's mood issues. And then, of course, the menopausal hot flashes, vaginal dryness. Most women kind of think about hormones with that, or PMS, If it's PMS 365 days a year, that's not PMS. It's right before your period. You want to just rip somebody's head off. Hormonal. Hormonal. So some clues right there. And of course you need proper and thorough testing, but that may give some of the listeners some ideas of whether or not maybe I should hormones checked.
Absolutely. How about at night when I don't want to be touched, and when you touch me, it makes me very irritable? Because I'm sure my boyfriend would love me to ask this question. Is that hormone or is that just Stephanie?
Oh, I don't know about that one. It's like, especially just thinking through here, if a woman's progesterone is low, it's like people just get on her last nerve. Yes. This estrogen progesterone imbalance. You just want to jump out of your skin and just don't touch me. Just leave me alone. Maybe. I don't know.
It's just so funny because I can be fine with being touched throughout the day. But man, when I lay in bed, hands off, man, like I am ready to go to sleep and do not touch me.
Been warned.
Yep. Yep. That's what I said. I'm like, I told you. So getting back to the ladies and their hormones. So, okay, so we have done these 7 questions. We think there's some things that are off. What are we going to go get tested for?
Well, testing is important. And so it's also important to find a provider that understands hormones and hormone testing, because it's so sad, Stephanie, that this isn't taught. Hormone balance is not taught in med school.
No.
And so with the 75 million women in the United States, they're in menopause. 75% of those women go get treatment and don't get help. So if your provider or your gynecologist or your family practice doesn't seem to be on board, it's not their fault. They just weren't trained. They have to, for a doctor to, or nurse practitioner, PA, whatever, if they want to go and learn about hormones, hormone balance, how to help, women in PMS with PMS or menopause, then they need to go get specialized training. But then they would, if you're a patient and you want to have your hormones checked, you do want to have your estrogen, progesterone, testosterone, your adrenal hormones, thyroid hormones, and blood sugar, insulin, fasting insulin, all these aspects for all. You need a comprehensive evaluation. You talked about estrogen, progesterone, testosterone being the reproductive hormones, and they are considered that. But these hormones, whether it be those or the adrenal hormones or the thyroid hormones or our blood sugar, they all work together or interfere or interact. So we want testing to look at a very broad view of every angle of our hormones. So then we can really figure out, hey, is it my stress hormones that are out of balance? Throwing my sex hormones out of balance, because we've all heard that word cortisol. Yep. It is considered the stress hormone. Well, that will certainly inhibit your libido, but it will block all of your other hormones. So we can't just have this very narrow tunnel vision of just about estrogen and progesterone and testosterone. We need to look at all of the hormones.
Yeah. And is testing once enough, or should you be getting it a few times so that you can kind of get an average?
Well, that is a good question. So initially, baseline labs are very important. And if a woman is still having her cycle, then it needs to be done on day 19, 20, or 21. It's a certain point of the menstrual cycle that we need to test to see how the hormones are lining up. And day 1 is considered the first day that you see blood flow, and that's how you count that. But to your point, we need a baseline level, but a very well-trained provider will also look at symptoms, because you're right. If you went and had your hormones tested tomorrow, that's tomorrow. That's a snapshot in time. So a seasoned provider is going to look at all your symptoms, and it's going to pay to, okay, this is what she made this day. Now let's put together the picture. But for the purposes of our conversation, you need baseline testing if you're not on any hormones. And then, you take whichever hormones or whatever is needed to get hormones or, in balance. If you make too cortisol, there's not really a prescription. There's other protocols and supplements. Yeah. You start your treatment plan, and then you do need to repeat hormone tests in about 3 months to know whether you're being dosed properly, or how, is this treatment plan working, or does it need to be adjusted? And from there on out, typically repeat testing anywhere from 3 months to 6 months to monitor, because you do have to monitor. It's not a one-time test. It's and we go through life changes, or we gain weight, or we lose weight, or more stress, whatever. Changes happen, and so you do need to continue to monitor hormone levels.
Yeah. It's interesting because I treat men for hypogonadism frequently. I'm just learning more about the female side of things, because you're right, it's not taught to us. But in urology, I certainly treat a lot of my guys for hypogonadism. And so, I'm very familiar with monitoring their testosterone and how often I make changes and things like that. And I do it based on the number, but also the symptoms. Because some of our guys, even though 300 is still considered normal, they are not functional at 300, and they need to be closer to 600 or 700 to feel good. right?
Yeah.
So is that kind of what you're saying about the women then too?
Yes. And normal isn't necessarily optimal. So
Mm,
when there's a which, for the
yeah.
listeners, she's talking about reference ranges. So the lab will give you a reference range, like, estrogen should be here and here. It should fall between whatever number and other number, the top number and a bottom number. And if you make just the bottom end, oh, you're technically normal according to the lab, but not necessarily from an optimal standpoint. So normal versus optimal. Well,
Yeah.
I don't want to have just enough of something to be alive. I want to feel good,
Right. Right. Yeah, no, that's such a great point. I love that. And I think too, especially because as of right now, hormone therapy is not necessarily always covered by insurance. And so there's a little bit more wiggle room with that. Whereas, my guys who want to have their testosterone covered by insurance, if we're not hitting that below 300, then they're paying out of pocket. And so then I have to kind of negotiate those conversations with them too. Like, hey, first of all, testosterone is not expensive, but it's also, like you're saying, like that optimization. It's not just, okay, well, you're normal, but that might not be your normal. That's not optimized. I love that take on it.
You're right. And I love how you personalize your approach with your patients. And so it's the same for female. Maybe it's thyroid that we're talking about. And, that's very important to do all the right tests and interpret it from a more progressive standpoint, looking at symptoms. Because, if you don't have symptoms, okay, then what are we here for? But
Right.
if the patient has symptoms, then that we need to work on finding the root cause of those symptoms. And so I appreciate how you treat those male patients, because yes, they're going to be symptomatic at 500 or less.
Yeah. Yeah, absolutely. So for our ladies here, we've done the tests, they have the symptoms, they're on the lower side of normal or they're low. What are their options for replacement therapy?
Well, I prefer bioidentical versions of hormones, because that's where we feel like we have the best data for safety. Or again, they're exactly the same hormones as we're supposed to have anyways, as opposed to an animal version or a synthetic version. Because when you put like a hormone that's non-bioidentical into your body, you're going to have side effects. They just work the same. So when it comes to bioidentical hormones, then it can get even more nuanced, because there are injections, there's pellets, there's creams, there's patches, there's pills. So there's a variety of different ways that you can get these hormones. They are by prescription for the most. You do need to get them from your provider. But when it comes here's where dosing forms vary. But here's critical points to remember: we never want to use oral or by pill, by now, estrogen. We want to use topical, whether it's vaginal or a pellet or a vaginal patch. We never want to swallow estrogen. So oral estrogen increases the risk for blood clots, even if it's bioidentical. So we want to avoid oral estrogen and oral testosterone. From there, if we're using progesterone, oral progesterone's fine. It's great for sleep, or DHEA. Those are okay orally, but just two critical points for everybody to remember: no oral estrogen and no oral testosterone. Now, make them in a different form. Vaginal, topical cream, pellet, patch. We're okay with those. And those we know are effective and safe.
Yeah. I'm very comfortable with vaginal estrogen. My ladies who come in with recurrent UTIs, genitourinary syndrome of menopause, those kinds of things, I throw in them at the vaginal estrogen, because it's just, like you've said already, it is so safe. It is efficacious. It is just, it's life-changing for some of these ladies who have frequency, urgency, UTIs monthly, pain with sex, vaginal dryness. It's helping all of those things in such a simple cream or pill that you insert in the vagina.
And what we have learned now, that this is, in the past few years, I've been in this field for like 30 years, and it's been so wonderful to see all the different progression and changes. But you're exactly right. vaginal delivery of hormones, whether it's a cream that you just rub on or apply labially, is mucosal delivery. So it's different from rubbing a cream on your skin, but mucosal delivery is highly absorbable. So these hormones delivered vaginally are safe. They're very absorbable. And you brought up something, if you don't mind me adding one more thing. Vaginal estrogen is fabulous for vaginal dryness inside the vagina. And for, yes, exactly, preventing urinary tract recurrent UTIs. But if there's vaginal dryness around the outer area, that could be low testosterone. So they work on different areas. And if we're talking about using a testosterone cream, that's wonderful, used labially or vaginally, but also on the clitoris, like an hour before sex for extra fun, because there's a lot of testosterone receptors around the clitoris. So
I love that
tip.
Yeah. Now, do you have your ladies get like compounded creams where they have a little estrogen, progesterone, testosterone kind of all mixed together, or do you prefer them to take their hormones separately?
It is fine either way. Initially, when providers work with their patients on getting them on the right doses of hormones, they might want to separate them, because initially you start a patient on hormones and then you might have to raise one, lower one, might have to make some adjustments. But once you get the levels where they're ideal, the labs look pretty good, the patient is happy and they're feeling better, then certainly you can combine hormones and get them from a compounded pharmacist, which is where some of the bioidenticals come from. And some bioidentical hormones, like patches and like your testosterone injections, do come from conventional pharmacists. But compounded hormones are a great and more affordable way than sometimes conventional hormones. So it can be certainly a benefit to use compounded hormones.
Yeah, sure. I can think of, like, if you're doing an injection for your testosterone, some cream for your estrogen, a pill of progesterone, if you could get them once you are balanced, like you're saying, once you kind of know your mojo and your doses, then if we can get that all combined into one, man, that would be so nice.
It can be definitely much more convenient.
Yeah, for sure. So how do our patients find a provider that is well-versed in bioidentical hormones?
That's tricky.
It is.
Admittedly, there just aren't enough, which is part of the reason why I do the work that I do. But it's so interesting, Stephanie, that more and more and more conventional providers really are interested in bioidentical hormones and learning how to help their patients. So it's really wonderful to see that. We have more and more gynecologists calling, saying, really want to learn how to do these bioidentical hormones. So to find a provider. So there are, I do have a listing on my website, but if you're looking for one, if you're looking online in your area, you're going to look up BHRT providers. And then there's some real important tips here. Looking at their website, picking up the phone, calling them, ask them some important questions. How long have they been doing hormones? Do they test all of the hormones? Do they also look at the adrenal hormones and thyroid hormones, and make sure that they do all of the different dosing forms? Remember, again, dosing forms are creams or patches or pills or pellets, a variety of things. Because here's why I bring that up. There are some practices that only have gone to learn how to do hormone pellets. I love hormone pellets, but not everybody wants a pellet and not everybody's a candidate. So if you're calling someone in your area to find, to get proper testing and proper hormone balance, if they only do pellets, then they've not had enough training to get your hormones back in balance.
Yeah, absolutely.
So you're going to ask them, how long have they been doing hormones? Do they test all of the hormones? And do they do all of the different dosing forms? Now, you brought up compounding pharmacists. So if you're in an area in a city, another way is to find a doctor is to call the compounding pharmacist and say, who's doing hormones? Let's say we're in
Yeah.
Atlanta. Who's doing hormones near me in Atlanta? They know because they get the prescriptions, and they also have some clue as to, do those patients really like that?
Right.
The women love this doctor. Oh, go see this one. So that's one inside way to find
Great tip.
a hormone provider as well.
Yeah. Yeah, no, that's a great tip. I would not have thought to call the pharmacist. So that's a great idea. Yeah. Oh, for
They
sure.
hear the good, bad, and the ugly about
Yeah.
the
Yeah.
symptoms.
Absolutely. That makes me a little nervous to talk to my pharmacist.
There you go.
That's great. So once they get on hormone replacement therapy, bioidentical is what we're going for. They are going to get tested. Is it ongoing every 3 to 6 months, or are there manipulations once you kind of figure out where you're at?
Well, once someone's in balance, and once you reach menopause, like I haven't had a cycle in 10 years. I'm 62, so I'm not going to have the monthly fluctuations as a woman in perimenopause does, and so you might need to be tested every 3 to 6 months. But normally, once hormones get into balance at any age, things are going to stay reasonably the same. However, if you go through stressful periods, or if you lose a lot of weight or gain a lot of weight, or something changes, pain affects stress hormones. If there's significant changes, there will need to be testing. But generally speaking, you do need to be tested at least twice a year.
Okay. Yeah. That would make sense to me too. And then anytime that you do manipulate
When you get them, on the right dose, you just periodically probably monitor them a couple times a year.
Yeah, absolutely. And then if we do have to make changes, I'll do it a couple of times back to back. And then once they're stable again, kind of back off to twice a year. So that makes a lot of sense. Yeah. Yeah. So, okay. In your book, you talk about the 4-part plan. So one part of that is the hormones and getting them balanced. And then you also talk about reducing high levels.
So as there's a few hormones that we can make too much of, and that is cortisol, the stress hormone. And some women make too much testosterone. These are women that might have acne or facial hair or PCOS, polycystic ovarian syndrome. They make too much testosterone. And then sometimes women make too much estrogen, and they don't have enough progesterone to balance it out. So it's not, to your point, it's not always about low hormone levels. Sometimes the balance can be the other way around, and we make too much. And that's where testing will define it for you. And that's where knowledge about, okay, what do we do about high levels? That's where good training comes into play there.
Okay. All right. And then your next thing that you talk about are supplements. So it's not just about getting on the right hormones, but there's also some supplements that can help us.
That is exactly right. So the goal is balanced hormones, whether it be stress hormones, these, reproductive sex hormones, or blood sugar or thyroid. The goal is balanced or optimal levels, because that's when you're protecting your health long term, and that's when you're alleviating symptoms. So that's where we want to get. So, and that, like we've been discussing here, it's not necessarily only about taking hormones. It could be about reducing high levels of hormones. And so here's where supplements, dietary, and lifestyle changes come into play as well. So if there's certain supplements are needed to support the adrenals if we're overly stressed, or certain supplements help with lowering excess testosterone in women if that's their issue. And then supplements in general support hormones, our body being able to use hormones. Like hormones work in a receptor, kind of like how a key works in a lock. So we need basic nutrients like zinc and B vitamins, all of the right nutrients for us to use the hormones that we're making or absorbing. So supplements and good diet is very critical. And lifestyle changes. So I've heard somebody say you can't out supplement a poor diet. Well, darn it, that's true. I'll take all the supplements in the world, but also we can't eat junk and then take a hormone and take a multiple vitamin, and no, we have to do the other things as well.
Yeah. So with lifestyle, being exercising is really important. And there's specific things for women in menopause that are recommended more so than maybe other times of your life. I think one of the ones that I was reading about is how much strength training is important.
Agreed, because, women lose muscle, and unfortunately, most of us have sedentary type,
Mhm.
jobs where we're sitting too much. So yes, strength training is so important. And so is testosterone to help maintain muscle mass as we age. And not just testosterone, it's about eating enough protein.
Mhm.
Unfortunately, far too many people will just grab carbs and maybe some vegetables, but not getting enough protein to maintain muscle mass and grow
Yeah.
hair and bone
Right.
density and so forth. So
Right. Yeah,
we
I
have
always
to
think of
do
the bone
all the
density.
things.
Exactly. Yeah. And bone density, I mean, I feel like as a society have kind of gotten away from the got milk posters that were there for so long and, and the promotion of good bone health. But it is imperative because as you and I both know, for a fall for an older person can be the start of their decline.
Absolutely.
So
So
I think, I love that you're kind of getting this holistic approach in your 4-step program because it's not just about the hormones. It's not just about the balance. It's holistic. You have to have the diet, the lifestyle, and the hormones balanced if you want the best outcomes.
you do it, and it sounds like, Stephanie, it sounds like a lot. I'm hearing us talk about it. It
Yeah.
sounds like a lot, but small changes do make a difference. And if you're working with a good provider like you, and they're helping guide you through,
Mhm.
and simplify it and make it practical, it's not as overwhelming as it
Yeah.
might sound.
And I love the way that you've written your book is not overwhelming at all. I think you have
Uh,
practical tips in there. It is written very easy to read. It's quick. It's not even a long read. So you can get through it in a weekend and start preparing for Monday and your lifestyle changes, even if you haven't gotten into your provider to have everything checked yet. So I really appreciate your take on this. So because this is a Between the Sheets podcast,
huh?
what are some things specifically for women who part of their hormone imbalance is decreased libido and, difficulty achieving the orgasm? What are some things maybe specifically they can do in relationship to their sexual health?
Well, I'm glad we got to have a little time for this too, because it is important. It's a part of our quality of
It
life.
is.
So when we're talking about sex drive and libido, it, there's different components, right? There's desire, there's satisfaction, there's function. I've heard it called that there's the can do and the want to. Some of us want to, but then in the moment,
Yeah,
or there's like,
exactly.
I don't even want to, so,
Right.
so there's
Right.
these different aspects of, we're complicated. I mean, your male patients, they're so easy.
They are.
But as women, we are complex creatures. But what we know about hormones, again, now I'm drawing from research. So
Yeah.
what does research say? Unfortunately, there's not a lot of research that has been done for us on
Mhm.
our libido and sexual function, but there is some. And there is supporting research on testosterone in women with libido as far as helping with sexual satisfaction, desire, frequency, arousal, and orgasm. So, as I snuck in earlier, there's a lot of hormone receptors around the nipples and the clitoris. But if our testosterone is low, any stimulation, we just don't really feel it.
Yeah.
We just feel kind of numb there. So, testosterone is important to help women, but
Mhm.
it's not the be all end all. I,
Mhm.
I I wish there was some magic pill. There's
Yeah.
not a magic pill because we
Yeah.
have these things in here called emotions.
Right.
Emotions in there. But we do know from research testosterone is important and it is very helpful, as is estrogen. Estrogen helps us feel sexy and helps us, also have some desire, but also helps with that, with the vaginal tissue, with elasticity and lubrication. I mean, who wants to have sex if it hurts? And,
Right.
if we have vaginal dryness. So if you have vaginal dryness, that's a telltale sign that we can help you. Something can help you. And it's like Stephanie says, it's vaginal hormones that can help so much with vaginal dryness, whether it's, any of these hormones can be used vaginally. Estrogen, progesterone, DHEA, testosterone, all can help with saturating that tissue and getting rid of vaginal dryness. So that is something to think about. So progesterone can help with sexual function as well. So can DHEA. But let's circle back to testosterone for a second. I want to talk about something.
Yeah.
As I said, it's not the be all end all. Oh, go get some testosterone cream and you will chase your husband around the room. Not so easy. It definitely helps. It helps us think about sex more and experience pleasure. But for women on SSRIs, that blocks sex drive. So antidepressants. I'm not saying stop taking it, because you're having marital problems and you want to save your marriage. Don't just drop your SSRI. Get help with that. But we think about things that block our libido. Antidepressants do. And so can oral birth control. This isn't talked about enough. Oral birth control lowers testosterone. Okay, that's a given. We know that clearly because that's how it works. So women on the pill have reduced testosterone levels. Women on the pill have increased depression. Well, that doesn't help sex drive. And women on the pill can shrink the size of the clitoris. What are these young women supposed to do? No wonder they're struggling. They don't have any testosterone. Their clitoris is smaller and they're depressed.
Yeah.
That is sad. So, so we have the hormones which can help with vaginal dryness, with lubrication, with function, with hypoactive desire disorder, with anorgasmy. So the hormones can help with that, but so can certain supplements as well. Because we're not going to go take a hormone just to fix our libido. We're going to take a hormone because the hormone is low. Okay. Yes. So we're going to be doing them properly and doing them as they should be. But there's certain herbs that can help too, like nitric oxide boosters. There's some herbs like Damiana, Maca, Afron, Tribulus. There's combinations. Those can help women as well if they're struggling with low libido or poor sexual function. But I really appreciate that these women struggling with this could find a caring provider that can really work through it and help these patients, because something's going on, especially if they maybe in their younger years they had a normal libido and then it just one lady told me my sex drive just drove off. Bye-bye. Like, if you used to have one and you don't, then that's a clue. But if you that could be helped again. And if you never had a good libido, maybe there's something that some of the sex therapists can do to help. And by all means, yes, get hormones and everything, maybe neurotransmitters and nutrients, look at all of the angles. But I just hope that women would feel that they don't have to continue to struggle, that there is help and there is hope. And that's why I appreciate your podcast. Women need help and they need to know that there's something that they can do. They just need to know what to do.
Yeah, and that it's okay to talk to us about it.
Yes.
Please come tell me your problems. And even if I can't help, I can get you maybe to somebody who can. And hopefully I will be going through the bioidentical hormone training so that I can help more often. But I send patients to pelvic floor physical therapy, sex therapy. Yes. I get them on their vaginal estrogen. We talk through a lot of these because it is multifactorial.
For sure.
Yeah, absolutely. So, no, I really think that, for so long, it was just, well, deal with it. This is just a part of your life. You're going to go through this.
Yeah.
But we live half of our life after menopause.
Those days have gone.
Yeah. I'm going to live the second half of my life real good.
Yeah. Well, the days of no information and not being able to talk about these things, those are gone. Women are talking. They're asking. There's people like you. We're getting information out. So those days are gone of nobody knowing what to do and this be all hush hush. in that.
Yeah, absolutely. And I'm so grateful for that. And I love how long you've been in this and doing it. I was so surprised that, some of this research has been coming out since the 1970s, because you really hadn't heard about it until more recently, other than the Women's Health Initiative that everyone heard about, unfortunately. But no, I just think that this is such a fantastic topic. I love that this is your life's work, and that you not only help the women, but you also help us as providers. You have a training academy.
I do. We have a training academy that at this point now we've served well over 4 countries. So we train medical providers in how to prescribe bioidentical hormones and get hormones back into balance, and the supplements and the things that that are necessary to help patients. And we certify them and give them a very thorough training.
Yeah, I love that. I love that because, like we mentioned earlier, it's not taught in med school. It wasn't taught in my nurse practitioner program. So certainly something that the education side of things is lacking for providers as well. So I love that you have that. I am very excited about your book, and I have been following you for a while now. So I'm excited to share this with my patients and our listeners. And in the show notes, I'll go ahead and put links so that people can find you and your book. And I just thank you so much for being on here. This was such a wonderful discussion.
The honor was mine. Thank you.
Absolutely. Well, everybody, I hope you get your hormones checked out and balanced and have a good libido. And I'll see you next time on Between the Sheets.
Thank you.
Thank you for listening and spending time with me today. You can catch new episodes of Between the Sheets every Wednesday, because what better way to add some spice to your life than to have a new podcast on Hump Day? We will continue to explore common, uncommon, and taboo topics related to sexual health and wellness. Please send any comments, questions, or stories to podcastbetweenthesheets@gmail.com. That's all one word, podcastbetweenthesheets@gmail.com. Have a great day. And remember how important it is to discuss these topics with your friends, your family, and of course your partners. In fact, you can like, follow, and share this podcast so they can see it too. See you next time for more sexual health topics between the sheets.